Good morning, everyone, and we're going to continue today, Chapter 5, Grade 12. Attention Deficit Hyperactivity Disorder is the topic for today, also known as ADHD. Now, ADHD is of two types. Either you have ADD or you can have ADHD. Now, ADD means Attention Deficit Disorder. ADHD is Attention Deficit Hyperactivity Disorder. So, this is comes under the clinical diagnosis of the DSM 5. Now, the DSM 5 is called as the Diagnostic Statistical Manual. The latest version is 5. So, ADHD comes in that category of the neurological disorders. Now, ADHD is more common in boys than girls. 1 in 3 or 1 in 4 children are affected by it. It starts from early childhood, goes on till young adulthood. So that 20-year span is there and the child is affected by that issue. So, ADHD, the causal factors. What are the causal factors of ADHD? Number one, during the prenatal development. So, when the woman is pregnant, if she has been stressed throughout her pregnancy, a lot of tension, or she has undergone some sort of a trauma, tension, that could lead to one of the causal factors is ADHD in the child. So, number one is the prenatal factors of the mother. The second factor could be that if ADHD runs in families, if your grandparents or your parents also are the type A personality type of a person who's always on the move, who's hyperactive, attention deficit, there is a possibility you could inherit it as well. So, this could be running in families, it could be due to the prenatal care, in fact, not care, but it could be due to not proper care during the prenatal development by the mother. Now it has nothing to do with faulty genes. It has nothing to do with the faulty chromosome or genes. It is not genetic. Unlike mental retardation that is genetic or it is due to the faulty chromosome. So ADHD has nothing to do with faulty genes or an extra chromosome on the 21st which leads to Down syndrome. So, but this is something that it can run in families. So, this have the biological issue to it. Now, another biological cause of ADHD is that there is an issue with the brain. So, when the child has ADHD, the psychiatrist prescribes some medication. The name of the drug is Ritalin, one of the medication that is prescribed to a child who has ADHD, so that he or she can calm down. The nerves can calm down, the cells in the brain can calm down with that medication. Now, along with medication, the clinical psychologist, after the assessment has done, yes, this particular child fits into the category of either ADD or ADHD. After the proper diagnosis has been done, and then of course the medication with the psychiatrist, also psychotherapy also can be applied. So behavior modification techniques as well as cognitive behavior therapy, both of them can be applied for ADHD situation. In schools, it's a big havoc for the teachers In the house, it's a big havoc for the parents to handle such children, especially during the early adolescent period. But luckily, after 30s, or maybe 25, 30s, when the child becomes a young adult and when he starts settling down in career, gets married and all, hormonal changes stop functioning during that time, and then the child and the young adulthood becomes serious with his life, becomes more responsible with his life, so it can be controlled during that time. Certain symptoms could be there. Now, the main symptoms of attention deficit hyperactivity disorder are extreme hyperactivity, inattention, impulsivity, lack of concentration. These are some of the main symptoms of a person having ADHD. Now, if a person has ADD, that means it is minus the hyperactivity. So, ADD means inattention. So, the child or the young adult is having inattention, such as not able to concentrate for a long period of time. The sustained attention is very less in that particular person. So now we have two types. I'll just give a little revision of this. So there is ADD and ADHD, more common in boys than girls. Yes, it can be managed and controlled with proper behavior modification techniques and with medication and guidance. But remember one thing, that just because a child is naughty, or just because the child is hyperactive, or just because the child is lacking in attention, we can't diagnose him or her as ADHD unless and until all the criteria has been ticked properly and the correct diagnosis has been done. So it has to be prevalent at home, at work, at play, with everyone. It's not that, my child or my young adult is, extremely active at home, but in school he's dull. It's not like that. It has to be prevalent everywhere. Right? Thank you.